I'm John Haywood. I'm 47 years old. I'm based in Bury in North Manchester. At the time of my diagnosis, I was working full-time as a police officer for Greater Manchester Police. And on a personal basis, I was really active. I'm someone who's always maintained a very healthy lifestyle, eating well, regular exercise. And I was diagnosed with non-HIV Kaposi sarcoma in September 2019. And I was then diagnosed with Hodgkin's lymphoma in October 2019. So in respect of my treatments and my pathway, it was determined that for the sarcoma, that would be removed via surgery, and for the lymphoma, that would be treated with radiotherapy. And in respect of where I was kind of at, or concerns, I had a lot going on, having started a new role at work, having just took the back of our property off, doing some housing renovations, so the builders were in. So I didn't really have concerns in terms of worrying in what the outcome might be. It was more, let's get this surgery done, let's get this cancer chopped out. And my concern was more around what is my mobility going to be like post-surgery, because it was explained that my ankle would be delicate, it's in the area of the Achilles, and there might be a risk of some long-term issue in that respect. So that was probably my biggest concern, because that surgery was not successful. They were then postponing that to give me the treatment for the lymphoma. So while that's happening, I'm thinking, well, there's going to be a number of months now before I get the radiotherapy on the ankle, where they've done 2 operations, neither of which have been successful insofar as removing all of the cancer. But you can't help but think, well, this isn't a visible cancer, so what if that grows more? Will the radiotherapy be successful? Because I was told that it should do the trick, but there was no guarantee that it would. Everybody who, from the Christie and every other hospital has been absolutely fantastic. And I couldn't speak more highly for them. What I would say is, if you could prompt patients almost at every opportunity to think through what questions they might have ahead of coming to an appointment, particularly the appointment with the consultants, because, you have that window that you wait for, and then it's gone, and you walk out the door and you think, I should have asked this, I should have asked that. Not everybody, has contact with people that are in the NHS or in cancer services. So I was in a privileged position in that respect. But had I not been, I think it would have been really different, and it would have been so much more difficult for me. If people can be informed explicitly around what support is available for them and their family, different people will absorb things different way, but if you can perhaps put something in someone's hand that they can take with them and not be reliant on just looking at a tired poster that's on a notice board, which is all great and all the rest of it, but it's pretty invisible when you're walking in there with your mind full of stuff that it will be full of. Yeah, you see it, but it didn't go in.